So welcome everybody to this webinar, looking at the question of what it takes to deliver truly person-centered care. And this is a webinar that we're putting together as part of the Named Social Worker Programme. And that programme is supported by the Department of Health in partnership with Innovation Unit and Sky. And we're going to be talking today about this question of person-centered care. The reason why we're asking this question is because we're in support of the sites. As part of the programme, we're recognising that actually sometimes it's quite challenging to deliver truly person-centred care. And so we're bringing together a group of people from around the country who are doing really interesting things in this space to share a little bit about what they're learning, about what it really takes to work in this way. So in terms of the agenda, we're going to start by having an introduction to the Named Social Worker Programme, a little bit about what we're trying to achieve as part of it and the work that the sites are doing. Then we're going to hear in a little bit more depth from the Bradford team. So that's Elaine James and Rob Mitchell from Bradford County Council. They're going to be talking about the work that they've been doing as part of the Named Social Worker pilot. We're then going to move into thinking about what other experts around the country are doing in the spirit of learning about person-centered care. And we're really excited to have with us Igor Tojcic from Lama Katzie, who's going to be talking about what it takes to really engage people and rehabilitate people within mental health services in creative ways. Then we've got a chance for questions. So I can see that quite a lot of people are typing in on the chat function. If you type in your questions in there, we're going to be fielding those questions and making sure that you kind of can ask them to the speakers in the first pause. Then we're going to be passing on to Trisha Nichol, who's got some really interesting stories from the work that she's been doing with West Sussex Council, and to talk to Alex Jones from Wigan Council, talking in a slightly different setting around what person-centered care looks like, supporting adolescents who are often seen as complex for systems. Then we're going to be moving back into questions, so reaching out to you again, looking at the questions that are coming through, and we'll be finally, Lynn Romeo, Chief Social Worker for Adults, is going to be summarising for us some of the things that are coming out from our conversation that she's most interested in and excited about, and bringing us back to thinking about the Named Social Worker pilots that are taking place. So as I've said before, there's a few occasions for people to be asking questions throughout this webinar. There's 3 different options for you to use. So you can use the webinar chat function, which I can see a lot of people already are using. So please put your question on there. One of the other options is on Twitter. So hashtag Named Social Worker will be picking up questions on the Twitter handle. And then finally, we can use the email address nsw@innovationunit.org if neither of those other 2 options work. So please do send in your questions. For those questions that we're not able to answer in the kind of time that we have on the webinar, we'll be able to follow up. We'll be able to ask the speakers to follow up with afterwards. So the Named Social Worker Programme, just as a bit of context to why we're bringing you here today, the Named Social Worker Programme is looking at what it takes to work with people with learning disabilities in a different way. What does social work look like when an individual has a dedicated caseworker, when their main point of contact, they know their main point of contact, they have a regular main point of contact, and when they have a professional who is the voice of challenge across the system for them. And that was defined by the Department of Health a few years back in response to the Winterbourne review and the No Voice Unheard consultation. And so the Department of Health then asked the question, if this is what we know that we need, that needs to be in place, what does it therefore take to deliver this? What does it take to have a named social worker approach? What does it mean in practice? So we're now in the second phase of piloting a named social worker approach with 6 local authorities. And what that means is asking questions about what is the social work practice and the wider system conditions that will help improve outcomes and experiences for people with learning disabilities and the people who support them. In each of the 6 sites, there are slightly different models being developed, and each of the models aim to there's slightly different models being developed, but they each aim to provide excellent person-centered support for individuals with learning disabilities and the people around them. They each aim to equip and support social workers to be enablers of high quality, responsive, person-centred and asset-based care. And they also each aim to build a more effective and integrated system, bringing together the health, care and community support, and also the efficiency savings that the system is looking for. So these are the three components of the Named Social Worker programme, and what we recognise and we think is really important and is why we're here today is that all of these three are essential ingredients in order to be able to deliver the truly person-centred care that the first point highlights. So we recognise that person-centred care, in order to be delivered, the social workers need the support that they need and the system needs to be able to respond to that. So hopefully today in the examples from the speakers, we'll be able to see how person-centred care is brought to life at all of those different levels. So I'm now going to hand over to colleagues from Bradford who are going to talk about in more detail about what they've been doing as part of the pilots and how they've been bringing person-centred care to life.
Hi, I'm Rob Mitchell, Principal Social Worker for Adult Social Care in Bradford.
And I'm Ellen James, I'm Head of Adult Social Care Policy and Strategy. Okay, we're going to talk a little bit about our experience as one of 6 areas that are part of the Phase 2 for the Named Social Worker pilot, and hopefully we'll try to illustrate a little bit of this with examples of what it's really meaning on the ground in terms of practice. And wanted to start with who we were working with. We've originally decided that we thought we needed to work with 3 different types of people who experience social work services. So we focused on working with young people in transition who are experiencing the change between children's and adult services. We also looked at identifying people who are living in the community who are at risk of an inappropriate hospital admission. And we focused as well around people who are in assessment and treatment units. And for us, it's been really important that we have 2 really big partners with us as part of our approach in Bradford. And one's the University of Lancaster, which is the home for the Centre for Disability Research, and they're working with us to make sure that everything we do is grounded in a really strong evidence-based approach, so that all the way through we're learning from everything we do, and we're constantly critically reflecting about what we think we've learned and whether that's really what's going on. And we're also working really closely with an organisation called Bradford Talking Media, and they're a user-led organisation, and they are fronting a partnership of 7 different self-advocacy user-led very small local organisations in Bradford. And what we're finding, which is the buzz, is that the more we talk to user-led organisations about what we're doing, the more people want to be part of it, and that self-advocates have really strong views about what they want as an outcome from this process, and that their views are the ones that need to be at the heart of our learning experience. So that's really important to us. And very early days, what we've learned is that for people in assessment and treatment units, this is a really long process, and it might be we're looking at 2 to 3 years before we see a real effect, and the trauma that they've experienced might be lifelong. For people living in the community who are at risk, we're beginning to see some evidence that we might be able to make a difference with a different approach, an approach that isn't about a role and a function, but it's about all social work being better, and we'll come in a minute to what we mean by that and how we define that. But the biggest potential impact is if we think about how we help young people who are going through transition to experience better social work that helps them be right at the heart of the decision-making process about how they want to live their lives. So if we come to the next page.
Okay, so these are some of the things that have been important to us whilst we've been on this journey. Just to start off by saying that when we first began talking to people with learning disabilities about named social worker pilot, the people that we spoke to, the self-advocates, said that they wanted a named social worker for life. We then kind of moved that conversation on to begin to talk about what we thought was better social work. So we began to kind of extract some of the real kind of quality about what a social worker for life would mean, because the chances of having the same named social worker for life is remote, the chances of having good quality social work throughout your life when you need it, we think is a right for everybody. So that's kind of that kind of framed the beginning of our conversations. But these were just kind of some of the things, some of the barriers, some of the difficulties that we found along the way and that we're working on now. So the first one is that people really struggle to understand their rights, and that's been a little bit of an eye-opener for us. We as a social work service, we've talked for a long time about human rights being a great leveller, that the only criteria for human rights to apply is to be human. But actually for people who have had a lifetime of not experiencing rights, we've actually found that to be quite a difficult concept. One of the examples that we've got there is that we've used an adage of no meeting about me without me for people, and we've told social workers that we would really support them working with adults with learning disability to enable people to experience that no meeting about me without me. One of the kind of early feedbacks that we had from the social workers is that for a number of people with learning disabilities and their families, that actually was quite a difficult concept to understand, that if you've had that lifetime of feeling that there are always professionals who are meeting about you and discussing your welfare without your consent or your say-so, to actually break down some of the barriers and to give people permissions to begin to challenge is actually quite a difficult concept for a number of people. The second one was people who say that they disagree with professionals appear to be more likely to be subject to legal processes and restrictions. So we found that absolutely to be the case, particularly around, I've seen that there's a question around Principle 3 of the MCA where people make unwise decisions. One of the kind of ways that we've begun to tackle that is through a risk enablement model, and it's a risk enablement model that we've used through In Control, so it's been around for a number of years now. It's easily accessible online. But risk enablement for us is about organisations taking responsibility at a very senior level within the organisation to enable risk for people. So for our risk enablement panel is actually chaired by the director, or everything that goes through the risk enablement panel is signed off by the director, who takes responsibility for holding the assessed risk and the risk enablement, rather than the individual social worker, who sometimes feels a little bit kind of beleaguered in a multidisciplinary team when they're the kind of the one voice and that's kind of advocating, hopefully alongside families and people with learning disabilities.
And we've particularly noticed that language used by professionals and the way that they talk about people, and we very quickly default to describing people as risky or complex, and really not the case. Our most powerful local story at the moment is a young person who spent every morning going to the window to look out, and what he saw was young people like him in groups, and he couldn't understand why he wasn't in a group with other young people. The most powerful thing that's made a change in his life is he's now got 3 PAs using his personal health budget. That means he feels like he has a group of friends just like anybody else when he goes out and about.
So people labelled, and this is hard to leave behind. So this is, we had one example of a young, a man aged 19, where there was a recorded incident of him with a knife. We found that 20 years later, this 19-year-old, now aged nearly 40, in the residential unit that he was living in, was not allowed to be unaccompanied in a kitchen. And when we kind of traced that back, that went back 19 years to a one-off incident with a knife. So we found that kind of labelling is very hard for people to leave behind, and we've challenged our social workers to actually have a look, properly talk to people with learning disabilities and their families to unpick some case histories about some of the myths that have been created over the years in serviceland.
And the last example, just to illustrate who we're talking about, a young woman who she disclosed a really intimate moment in her life with her social worker because she believed that relationship was really important to her. Within 3 hours, 20 professionals who held power over her knew about that moment in her life. She only knew of one of those 20 who knew, because that's the person she'd told.
So language is a big issue for us, tackling kind of that dehumanising and oppressive language. One of the things that we've set up with our social workers is a peer audit, where social workers are able to audit case notes and recordings of other social workers where we've got consent of the person, in order that we can kind of self-challenge and be critically reflective in terms of some of the language that we are using. Somebody said to us a while ago that the jargon that we use in social care might not be Latin like some of the doctors use, but it might as well be, because we're using language that's effectively dead and meaningless, but can be extremely dehumanising. So we've kind of tried to enable social workers to be far more critically challenging of each other in the right kind of context.
And so what we think this means for us, and we think that there's some real issues that for us coming out around our approach and our values, and particularly recruitment for values. And we're trying to draw that together into a knowledge and skills statement about advanced practice around supporting people with a learning disability. And we're doing that in partnership with Bradford Talking Media and other self-advocates, so that it's something that they recognise and value. And then we're aiming next summer as a pilot site to test that. So the knowledge and skills statement would, in partnership with Lancaster University, provide a CPD module of advanced practice for social workers who want to specialise in this area of work, with self-advocates at the heart of delivering that programme.
Brilliant. So a massive thank you to Elaine and Rob, who have come all the way down from Bradford to share with us today. And we're going to take questions afterwards, so please do pass your questions, put your questions onto the chat if you can. Again, hashtag named social worker or nsw@innovationunit.org. I've spotted one question that asked about whether the slides will be available afterwards. Yes, they will. Anyone who's registered will share the slides with you afterwards. So thank you again to Elaine and Rob. We'll have a chance to kind of reflect on some of what they've talked about in the questions following the next speaker. So now I'm going to invite Igor Topchik to come and speak with us.
Hi, good afternoon. My name is Igor Tojcic. I'm the founder and the managing director of the company called Lama Katzie. We are the first creative rehabilitation service that combines the music and body movement and art-based therapy approaches into a coherent rehabilitation model for the people with learning disability and mental health issues. Innovation that we kind of introduced into a field is creating this therapeutic platform where all of the various therapeutic approaches are working in concert and enhancing their possibility of the improved outcomes for the clients. I'll talk a bit about just what we provide and how we work, and then I will go into describing some of the case studies of people that we've worked with. So we provide a range of services so we work basically, our facilitators work directly with the clients in a group settings. Each of the clients have the individualized support plan developed, and the facilitators are following those individual plans, but they are working within the groups, and that is intentional to improve the people's social interaction and to improve the kind of overall social interaction within the settings where we work. We work both in the acute and the community settings. We deliver, basically by working directly with the clients, we deliver that change. And then once we have developed a way of working with the clients, then we are providing the trainings for the professionals or the family members, depending on where the clients are living, to kind of learn about the way of supporting the clients through this new way of working. We also provide a consultancy for the service design to the senior managers to understand what kind of changes need to happen within the system in order to deliver this type of approach. Now, we have done this in a variety of settings and for the number of different client groups. So we have worked with adults in mental health in the acute settings and supporting them back into transitioning into community. We have worked with adolescents with mental health issues in the acute wards, 12 to 18-year-olds, tier 4 most complex clients within the NHS. That was evaluated as extremely successful intervention. And then we have worked with learning disabilities in the acute wards for adults, also supporting them back, transitioning them back into community as well, as in the care homes for learning disability for adults. So we have all of our programs have been evaluated independently, and they're showing some very significant improvements in outcomes, as well as the financial efficiencies for these settings in terms of the care provided. So we are currently part of the named social worker program, and we are supporting a number of clients who have been recently discharged, aiming to prevent their relapse. At this point, we were hoping to show you some videos of how our sessions work, but we were unable to do so. So I'll just kind of go into explaining how we work with the clients and some of the outcomes that I'll describe 2 case studies for you. So this particular slide is just generic. Our approach is basically, we believe it enhances the PBS model. So all of our facilitators get in-depth knowledge of the client's history and the issues. They work for quite a long period of time on building the trust and rapport, identifying the kind of specific facilitator who will be working with the client while they're working in the group, as a kind of almost named facilitator. And then we have an extensive kind of work about identifying clients' interest. It's basically giving people their voice back, understanding what their ambitions are, understanding what they're capable of doing and they're not doing in the settings which they're living. And then that leads to a meaningful engagement, basically aligning our support planning with the client's interests, so whatever those interests may be. So the support that we provide is basically the clients are actively involved in it. It's not just something that we are providing for them. They're basically in charge of the projects that they're doing, being that in the artistic, in the creative sense, being that creating the music videos, art, engaging in whatever routines that they decide that they wanted to have in their lives. This, we found, improves social interactions within the living setting. So because the client gets their voice, they are able to reframe their story, tell their story, and they become, in many instances, there is a kind of a moment of realization that they can function much higher level than what was expected from them before. So if we go to the next slide, please. I just want to kind of introduce you to one of the case studies that I'm going to be talking about. So this was a 19-year-old girl in an acute setting with the diagnosis of autism. She basically, as a part of that diagnosis and symptoms, she has a mirroring behavior. So in one of her previous admissions, she was surrounded with the patients with eating disorders, and she has basically acquired an eating disorder, so she stopped eating altogether. So at the time when we met her, she hasn't eaten anything for a year. She was peg-fed. She wasn't physically active. Her muscles atrophied, so she was falling frequently. She was wheeled around in a wheelchair, and she was really socially isolated within the ward. She wasn't interacting with anybody. So the professionals were obviously, clinicians were very concerned, and they were saying basically that they couldn't get through to her, and she didn't want to talk about her eating problem, and they just couldn't get through to her with the regular kind of models of treatments that they had available on the ward. So we spent lots of time establishing trust with this young woman, and then over time we found that her interests were, she was a fan of the specific pop star, and through that narrative we were able to start talking about that same pop star had an eating disorder, so we were able to kind of through that open the conversation about it. So within 6 months of working, she moved from being peg-fed to eating 3 meals a day, which clinicians saw as almost miraculous. She, through our Feldenkrais sessions, which is basically body support, she has become much more physically active. She has not fallen. She wasn't falling anymore. She has, from being very isolated on the ward, she has developed very supportive relationship with other clients. She has expressed a wish to kind of volunteer. When she goes out, when she is discharged from the hospital, she has managed through the creative outlets to reframe her story and kind of clarify her ambition of what she wanted to do, which was kind of up to that point, it was hidden. Nobody was kind of clear of what she was able to do. She created many songs, she recorded music videos, videoed them. So, and at the time of when she was discharged, the placement that she was placed in didn't need to have as complex need as initially thought. You know, they didn't need to have a clinical ability to manage the PEG and all the rest of it that initially. So her level of needs reduced significantly at the time of discharge. So I'll move to the second client. Yeah, and the second client, it was a 32-year-old. So it was a 32-year-old client who self-muted for 7 years. Last 3 years of that period, he kind of retreated to bed. He was not engaging with anybody. Again, through the same model of and approach, she became. She started speaking. She became much more physically active. Developed a daily routine. Told his story. Started to learn to play guitar. Expressed an interest to pursue development in DJ skills. It was discharged 6 months earlier than predicted. So these are just very kind of quick outlines of what kind of outcomes, positive outcomes can happen, kind of thing, when we engage with people in a different way.
Brilliant. Thank you, Igor. It's now time for questions. So we've had a few questions through. I'm going to ask the questions for Igor and Elaine and Rob. So if you could just send any questions through if you have any others. The first question I'm going to start with is for Igor. It's about working in a creative way with people. The question is, how can you upskill staff to be able to engage in these more creative ways?
We found that in each of the settings that we work, that staff already has as a part of the extracurricular things, you know, in a community, people know how to play instruments, people know how, you know, lots of people are in community choirs, but those skills are not brought into a workplace because they're seen as not part of the medical treatment. But, you know, we have found lots of very talented kind of being that support staff or nurses who were completely able to follow this particular way of working, and so it wasn't difficult at all.
Brilliant. So there's something about just as kind of recognizing with all the people that you're working with that they might have skills and interests. Actually, the staff equally find out what their interests are outside of work, and how do you bring that into the some of the staff assets. I've got a similar question from Bradford, which is around staff and social workers and how you empower social workers to be able to work in this different way.
Okay. Yeah, I think it's about kind of celebrating the tools that we have, really. And I think one of the real big things is that we've now got, for any practitioners that were working in days before the Mental Capacity Act, you remember how difficult it was. We have got the Mental Capacity Act. It's the most empowering piece of legislation that I think we're likely to have in our working lives. So I think that needs to be the centre, at the centre of everything that we do. I think it's about involving senior managers. One of the kind of developments that we've had over the past few years has been about principal social workers being the bridge between frontline practitioners, ensuring kind of excellent frontline social work practice, and also with senior managers and with directors. I think that's vital. Challenge to quite a lot of social workers and that I've spoken to over the years, which is next time you see your director, ask them if they know the principles of the Mental Capacity Act, and if they don't, teach them, because they're the most important people in your organisation. They've absolutely got to get that everything that you do has got to follow the principles and the ethos, the empowering ethos of the MCA. And another thing to say is that in trying to get people to work in a different way, and particularly around kind of MCA and around Principle 3, is that, you know, people taking unwise decisions who are able to take unwise decisions in the same way that we are all able to make unwise decisions. It doesn't mean that there is no social work needed from then on in. Actually, what it means from a social worker's perspective, if the person you are working with is making a series of legal but unwise decisions, your job just gets a lot harder, social workers. You've just got a really, really difficult job to do. It doesn't mean that you walk away and you allow someone, you walk away and you're watching somebody making some really catastrophic decisions. It means actually you've got a really, really difficult job to do, because you've got to try and be there every time, you know, the proverbial hits the fan. You've got to be there working with family members who are quite rightly worried sick about the decisions that the families members are making. It just kind of expands our role in social work, but nobody came into social work for it to be an easy ride.
Thank you, Rob. So talking about both the kind of reaching upwards and the challenges of going up to the director level, but also that everyday challenge of working with the families. So linking into that, I can see a question on the screen from Hannah Baptiste around cultural barriers when implementing the model. I'm not sure which of you that's directed at. I might ask Igor to start with it, and then we can pass over to Rob and see if you felt anything similar.
We found quite a number of, you know, on one hand, people were very receptive to the different way of working, but there is a certain aspects of the system which are not necessarily conducive for kind of people's rehabilitation or people's kind of enjoyment of life. There is a kind of this kind of overtly, I don't know how to describe it best, but you know, one of the best examples of it, when we started working with the care home, one of our first questions was, you know, do you have fun working? And everybody kind of looked at us very strangely and said, what do you mean fun? We are professionals, and you know, but we were just reminding them that, look, these are the people's homes. You're working with people on a daily basis. It has to be humorous. It has to be light. It has to be, because that element also brings up so many benefits, not only in terms of the person's outcomes, but also in terms of the intensity of how the care is delivered, and eventually it has a financial benefit. So so that's one of the aspects. There's also, interestingly enough, people make a very stringent distinction of what is the role of the nurse and what is the role of the activity coordinator, and while at the same time, you know, our facilitators kind of bridge all of those functions, you know, in order to provide the best possible care for the clients and move them to the next stage. So that's kind of my summary.
Thank you. And Rob, any response to that?
Yeah, I think, obviously cultural barriers. Our kind of big challenge, I think, in social work is some of the organisational culture that you have. I did a piece of work a while ago with frontline social workers, asking what their kind of what they thought their job was, what was the motivation, what was the single kind of reason, what were they looking for in the people that they were working with. For a number of social workers, they talked about safety, and I think, to be fair to those social workers, when you think about kind of the care management that's evolved through the kind of 1990s, that's kind of what we were kind of taught as a group of social workers to look for. We were taught to assess the lives out of people and then support plan them to within an inch of their lives and go back and review them every 12 months to make sure they were safe. When I talked to newer social workers told me that they use a really interesting word that we keep seeing in some of the court protection stuff. They started using the word happiness. They started talking about the people that they're working with, and actually, rather than talk about well-being, because well-being's jargon and comes from the Care Act, and real people don't get that, we get it, not often. What people really wanted to know is how happy their sibling was, or their son or their daughter was, or their mum or their dad was. And that was really eye-opening for me, that some social workers kind of really had latched onto that, and that was the kind of motivating factor for them.
Yeah, and from a leadership and management perspective, I think underpinning that is a really old-fashioned concept in social work that we really need not to lose, which is the idea of being critically reflective practitioners, and right from the very top, and building space for supervision, valuing that critically reflective space as being critically reflective, being open to conversations where you naturally critique practice, so that when criticism is also required, it isn't personal, it's just what we do. that's a really important part of changing some thinking, I think, and that feels like a really important lesson that we're learning as sites involved in this, and it sets the tone really, because if right from the top you hold leadership conversations where you talk explicitly about power and control and what is it that constitutes happiness and fun, and recognise all the things that are the things you get out of bed for on a Monday morning. You know, they're the same things that anybody gets out of bed for on a Monday morning. That and recognising where it worked and where it didn't and why it didn't, then that becomes a really important overcoming factor for everybody's supervision within your organisation. So, critically reflective organisations are an important part of it.
Brilliant, thank you, and thanks Hannah for responding to that. So we've got just one more minute, and I'm just going to ask a question from Celine, and this is again for Igor. How were you able to kind of communicate with this young person you were working with and understand what her interests were?
Okay, and the question is relating to them being self-muted. So yes, it's a really good question, because it relates to this method of working, that what we are insisting on, of working with people in groups while having the individual care plans, because people inevitably inspire each other. So while somebody may be initially very socially isolated, does not want to communicate, and will sit in a corner, by observing the sessions and other people engaging with the other activities, over time they will build up that confidence to start engaging in any way that they can. So in this particular case, after a few sessions, this person brought us a kind of written document of how she wanted to communicate, and we took it from there, and then it just kind of progressed, and it's kind of quite miraculous. I mean, people are talking about psychiatric history of being able to turn somebody's life in this way, but it was very much about kind of understanding what a person's needs were at that moment, and being able to kind of follow it up.
Brilliant, thank you. So that's all we've got time for in terms of questions for this first round, and we're going to just swap over speakers quickly, and then just kind of some of the headlines for me was really the power of that creativity in terms of the approach. So being person-centered, a lot of that is recognizing that each person is an individual, and that you'll have to be communicating in different ways, but also that the professionals as individuals, what's the thing that they enjoy, what are the things that they might bring to that table, and some of the reflective practice that can kind of help professionals to bring some of that out. So now, with some other really fantastic examples, Trisha Nichol is going to talk to us about the work that she's been doing in West Sussex, and the kind of the impact that the work that she's done has had on individuals, but also what that means for kind of a wider system that starts with what an individual wants.
Brilliant. Hi, everybody. So, I'm Trisha Nichol. I work independently. I work with health and social care commissioners, providers, and I work directly with people and families as well. Essentially, people usually ask me to help when they want to know how we can get people what I call gloriously ordinary lives. So that's what I'm interested in. So, thinking about West Sussex, so where it all started, I've known Debbie Buckwell and Charlie Connor. Debbie's the commissioner and Charlie's the personal budgets lead for children's services in West Sussex. I've known them for a few years now, and they were part of the Me, My Family, My Home project. There's a link there on the slide, and if you just Google In Control, Me, My Family, My Home, they were part of that project. And then last year they'd asked me to do some work for them, helping them take a closer look at how their education, health and care planning process was going. And Debbie told me at the time, we were chatting about how, apart from the fact that we'd identified that the system really wasn't joining up, the idea of education, health and social care wasn't joining up, they were finding out individual young people who Debbie was finding we just weren't getting it right for. People were getting stuck, and particularly when this was leading to a situation where the solution appeared to be we commission services out of area for somebody, and that just, she was rightly saying that's just not where we want to be going. Then there was one week when I was down there, and two young people came to our attention. So there was Noah, who was 5, and there was Tyler, who was 12, and the common features of both of those young people appeared to be that they were just too complicated for us to sort out locally. And the solution for Noah was, okay, we'll just walk away then. And the solution for Tyler was that we're going to send a 12-year-old boy out of area to a it was nearly £200,000 a year out of area placement. And we just thought, that doesn't feel like what we want to be doing. So, next slide, thanks. So the three of us sat and we had a chat, and we felt there's got to be a better way of supporting these two young people and the others, and by doing something really quite radically different. And we felt that Debbie felt there was probably nothing to lose by having a go, and she thought that I might be able to help and asked me to get involved. And it's probably fair to say the three of us are quite radical, quite feisty people. And so our first ideas were around this idea of a kind of SWAT team. If you've got to imagine images of us kind of parachuting in, and it was all going to be really fast and quick, and and we quickly agreed one of the key things was that what we needed to do, anything that we did, needs to be done alongside the existing professionals working with people, because it's really easy for someone to be seen as the saviours coming in. But we knew that we did have to take a very different approach, but we wanted to make a different approach that would be us working differently, that would hopefully have a knock-on effect culturally with the teams. We also knew that we wanted to demonstrate what it took to do things differently, and so we did have to set some criteria. So we did focus on education. So we focused on disabled children or children, young people with special educational needs who are not in school very much, who have a SEN support or who have an education, health and care plan. We figured it was probably usual or likely that their health and or their social care needs weren't equally being met. There was an imminent risk probably of longer family breakdown, and in almost all of the examples that we knew about, an out-of-area placement was being considered. And that kind of initial kind of ideas firmed up into the bullet points we've got there, and kind of that balance between, can we demonstrate that working differently gets people much better lives and actually save some money, because that's the two things that we need to do. And it just doesn't do it quickly. It doesn't do it immediately. It does it in a long term way. So what we're actually doing, we brought together a group of managers, practitioners, people who the common denominator was really committed to doing something different. I fair to say, again, quite a feisty bunch of people, definitely up for doing things differently, definitely committed to the idea of people getting really good ordinary lives, and committed to the idea of working alongside existing practitioners. We've currently got, I wrote the number 44 when I wrote this presentation last week. I think it's probably 45 now. We're not taking referrals. We definitely didn't want to take the approach of people referring young people to us. We're talking about having introductions. Is anybody you might think of that we might want to work with them? They're aged from 5 to 22. They've got a bunch of labels that we find complicated. We're working in some of the young people working really intensively with. So Noah and Tyler we've worked quite intensively with, and we're currently working with about 15 of them intensively. But we're also working with some young people. It might just be a fairly quick conversation, either with a family or with the practitioner, that gives them an idea for doing something differently. And the key, I think, is this idea of a different conversation. It's what we talk about a lot, is that we want to start a different conversation based on who the young person is and what great family life would look like. There's lots of elements of it. So apart from our conversations, we're also looking at, we've got the education focus, but again, by definition, lots of these young people, we were failing their social care needs. We're using personal budgets. We're looking at creative short breaks, and we're looking at wikis, which some of you will know about, kind of like a very secure Facebook page that's led by a family. And I put the link there on the West Sussex site that you can find out more about wikis. So if I say a bit about what we're doing with Noah and with Tyler. So I think a lot of ignoring advice goes on. So the key thing with both the young people, again, all the young people, is a significant number of people around them felt that it was too late. And we've kind of gone, should we just maybe think that it might not be, and we'll just give it a try? What would make a great family life, as far as Noah's mum was concerned, was that she wanted him at school locally with his little sister, and at the moment he was not in school at all. So over the summer holidays we supported some short breaks, but we also started approaching another local mainstream school, and said, what would it take? And I think what would it take is our most popular question. So whatever it is that someone says they want to do, we say, okay, great, what would it take? You'll see fishing written on both of these slides. In West Sussex, they have a fab education provider, alternative education provider called Angling for Education. And Angling for Education does what it says on the tin. It's a guy who's a keen fisherman who also is a really alternative educationalist, and who gets young people involved through fishing, through proper outward bound stuff, lots of really exciting stuff. And we've got some young people who haven't been in education for, some of them up to a year, who have no intention of going anywhere near a school, who are now having a really good programme of education via Angling for Education. And we're still working with Noah, but with the mainstream schools there, we're looking at what would it take to get him actually into school. He's not there yet. He's doing stuff with Angling for Education, but we're also looking at through a personal education budget, actually probably putting quite substantial additional support into school in a variety of ways that will support that school to make it feel like they can support him. Tyler's I love Tyler's example. So we met with his mum and dad literally just before the day before they were going to visit one of the 2 out of county placements, and said, would they be up for doing something a little bit different? And with slight arms folded, they did agree to. We promised that if after chatting to us for an hour, they still wanted to go ahead with the out of area placement, then we'd just walk away and it'd be fine. But we chatted, and they were absolutely up for it. We really focused on the idea of what did they think that the out of area placement was going to achieve in terms of getting a great family life, because he wasn't going to be there, and they were really terrified about having to tell him that they were sending him away, and they didn't want him to go away. We went the next day to visit them at home and to meet him, and Dad's a builder, and but hadn't been able to work for a little while because Tyler's got 3 siblings, and he's had to stop work to actually support mum and co-parent, and so he'd done some work on the house that hadn't got finished. There was a lot of things that needed doing in their house still that was making mum feel really quite low about the state of the house. Tyler's bedroom wasn't a great bedroom for a teenager, and the garden wasn't safe for the whole family. So one of the personal budget spends was on a skip and some of the stuff that needed doing in the house, and Dad family organised it all themselves. They had a DIY SOS weekend. Literally, we're talking within a week here, sorting the house out, which massively impacted on the family's sense of having a great family life. Again, he's on the role of a provider that he hadn't been in school for a long time, and he's on an education provider role and is having bespoke education provided. And I think the comment from his mum that says she now feels like his mum again for the first time in years is just says it all for me. And I put this final slide in. It feels to me that we're doing a lot of brilliant surgery in lots of places I go to around the country, and unfortunately quite a lot of patients are dying, no matter how brilliant the surgery is. So my focus really is on how can we make sure that the outcomes that we're getting for young people and their families are really, really great, and really focusing on that.
Brilliant, thank you, Trisha. And the questions, there's lots and lots of questions coming through. Lots of how do we make this happen where we are? So we'll get to them in a second. And now to talk to Alex Jones from Wigan Council. And what we're going to be talking about here is some of the similar principles being applied, but from the kind of organisation perspective. What does it take for an organisation to start working in this way?
Hi everyone. As Chloe said, my name's Alex Jones. I'm a service manager in Wigan Council with a lead around transformation and supporting within children's social care and commissioning. And I'm just going to give you a bit of a sense really of our approach as an organisation and how we're really taking that to within children's services and really focusing for young people in care and on the edge of care. So a bit of a context around Wigan. Our motto is the Wigan Deal. That's the branding. It's very much how do we work with our communities together as a partnership And really the recipes for that deal and working differently as we see them are having, as you've already heard today, having different conversations with our residents and communities, building assets and strengths, and getting to know our communities much more so we know what's out there. So we've really took that approach and started to think, how do we apply that for young people in care and on the edge of care? And a bit like Trisha said before, often our response is, things are really risky, what do? Send people away. We've, you know, there is a culture of removing the young person, not dealing with the risk, not looking at the whole situation. So we've really challenged ourselves in terms of how we think about that. And I think in starting with that, we've started to think differently about what our vision for our children and young people should be. So actually, if it's around them becoming a confident, resilient adult, we're not focusing on working with young people till they're 16, they're 18, we're moving them over to adult services, transitions happen. Actually, how do we start to challenge our ambitions as staff, as a workforce, the ambitions of our young people and family to think later into life and really what the chance of success could be? And alongside that, we've been really keen to develop a mission statement that supports young people, and we're describing that as children and young people. This is what they told us as well. They want to feel safe, they want to feel in a place where they belong, that they can call home, particularly for our young people who are in care. They don't often feel they find somewhere where they can belong. They have a fear of moving, not fitting in. They want to have trusting relationships that are connected to people and places that matter to them, feel able to explore opportunities that matter to them, and have the confidence to do great things now and in the future. So in terms of making some of that become a reality and how we do that, we've been really focusing on what our children's home, what a residential offer should be like if we're going to support this aspiration to work differently. So it's not about a place where we can send young people away and we don't need to worry about the problem. It's not a place that contains young people. How do we really create a sense of belonging and a culture where we're working with young people to help them thrive, to help them to be connected to communities and places that matter to them, and what's the infrastructure we need to create around that to happen, and the culture, the processes, the systems. So in terms of what we feel is different about our approach, and there's a diagram on there, and you've got a young person in the middle and the key worker. And I was a bit worried about putting this up because I was thinking everyone will look at this and say, oh yeah, everyone does that. Of course you do. Why wouldn't you have service users at the centre and someone who really knows them working alongside them? And yet we would want to have those other professionals wrapping around where we can pull in the expertise. So we have introductions, we don't have handoffs, we can bring people in and walk alongside. But to do that, you have to do it co-designing, working with young people and families at the centre. We really have to have those different conversations, build that design with them, be prepared to listen, act differently, not be boundaried by processes that we often feel keep us safe, but can sometimes prevent us from what's doing the right thing. So in terms of how we've started to develop that, we've looked at best practice evidence, what works. We've looked at innovations like North Yorkshire, our own innovations in Wigan, and in Rochdale we had a project called ACT and a local project called SHARE. And really, how do we create that one team, one manager culture, so you can bring in the expertise without referring on to another service? How do you really empower professionals to make decisions that are right for young people? And how do we have that stickability? So no matter what, we're with you, we're going to support you, we're not going to hand you on, you're not too complex for us and over you go to another service, we're still with you and supporting you. So that's really what we feel will be different about this approach going forwards. Okay, so in terms of provocations and a guide to challenge our thinking and decision making, what we've really focused on in Wigan, and we have our Be Wigan behaviours, and that's really our culture within the organisation to be positive, be accountable, and be courageous. And that real ability to challenge that throughout the organisation, from our directors down to support workers and everyone feeling brave enough to have that conversation. But also, would this be good enough for my child? Is it good enough for my child to say, no, I can't do that, or I'll move it on, or actually, yeah, you know, just going to school for an hour a week, that'd be good enough. Is it really? Are we managing the risks for organisations, or the risks to the young person? Is risk and our organisational approach being used in a way as a barrier that prevents us doing the right thing? And what kind of adult do we want our young people to be when they're 20, 30, 40, 50? Is really our approach now helping us be there? Is that helping us raise all our aspirations in terms of what that could be like? And is the shared approach to parenting for young people across partner agencies, are we all on the same page? Are we saying the right thing? Are we working together? That's been difficult. It's been challenging, it's difficult. It's hard to hear it when you're working every day with cases and, you know, you feel you're stuck or you're not quite getting it right. So what I thought I'd do is just, as part of the work, we've done a real lot of co-design with young people, with service users, with staff across. And we also had the opportunity to really start to take a deep dive and have the space to have different conversations with our young people, with ourselves as agencies. That really started to say, does that start with the aspirations? Is it starting with strengths? And just some examples of what that meant. So in a case for one young person, the aspiration was, let's just get him in any education, anything. I don't know what it is. He's not been for 12 months more. What can it be? Actually, when we started to find out what his aspirations were, what his strengths were, he just recently started to build a relationship up with his dad, and that was his passion. I want to get to know my dad. I want to be able to spend more time with him. We found out his dad had his own shop. Right, okay, could we look at him spending time and learning within the shop environment? Well, we can't do that. Can we make it work? Well, of course we can. Instead of paying for support coming in, why can't we pay for your dad and you can give him a wage and he comes in, he turns up every day. He's now been going in for about 6 weeks, working every day, really pleased to show us how he's ordering stock, really learning those life skills. Understanding young people. We got a young person who sets lots of fires on paper. He's an arsonist. You know, there's been no real understanding of that. When we started to get to know him a bit more, quite neglected as a young child, and actually he set fires to survive. It kept him warm. So what can we do with that now? It's seen as a risk in the home. He can't live in this home. He might endanger other young people. Well, can't we create a fire pit outside? Can he go out there and make fires when he's anxious, when he's worried? Can we build on that? Can he help with fire safety for other young people in that home? Of course we can. Sharing our parenting across agencies and our risk management. How do we do that? We've worked differently with the police. We've got an example of where a young person really difficult, challenging struggles actually has hurt staff quite significantly in the past, but by having that different conversation with the police, they've been prepared to come out before anyone's been hurt, have a different conversation, help us put in boundaries in place that mean we can continue to work looking forward. The challenge with this, and I think you'll have heard, you know, we've all gave some bite sizes in terms of examples that we're doing that make a real difference. The challenge to us all is, how do we scale this across the system? How do we make this systematic so you're not relying on one team, one individual who really believe in that approach? And I think for me, that's where we need to be braver around how we look at our systems and processes. And I think often they can be seen as the thing that keeps us safe. And I think we collectively need to challenge that. Do they? How do we build up that professional accountability and confidence so we are able to manage risk, strengths in a way that we're not boundaried by our policies, processes, procedures? And I think, you know, that's where we are now in Wigan. We're at a point where we're hoping to go live on this and make it much bigger, and really how do we take that elsewhere in the system so we're learning and continually building on those approaches.
Brilliant, thank you, Alex. So we've now got about 20 minutes for questions, which is fantastic, and a lot have come through already, so please type your questions away, and we'll be picking them up. I've got the first question for Trisha, and it's actually a little bit linked to the point that Alex was making around the kind of systems and barriers that are in place, and you said something about ignoring advice. Someone's question is like, how do you get the permission? Like, what would it take for someone else to do some of the work that you are doing?
Right, and I saw that there was something about, I was reading it as well, it was about ignoring the advice, but also about getting through to families as well, wasn't it? It was the two things. So I think we did, there's something in the power of a project sometimes, isn't there? Even though the project is about longevity, there is a power in the project and saying, we had very senior, so director level sign up across education and social care in terms of the local authority, and also support through health. They'd all put a little bit of money into the project. And one of the other questions about money, which I'm sure we'll come to. So when you've got a very senior level sign up to say that we've got permission to do stuff differently, that means you can come in and go. And we kind of do it. My style is to go a bit self-effacing and go, humour me, you've been working really hard on this, but we've got this opportunity to do things a little bit differently. It might sound a bit kooky and a bit quirky, but humorous. And then I go a bit wide-eyed and ask them very different questions. Sometimes when I'm working with families, I'm a mum as well, so I think that does help, because I can ask questions to other parents that say, that's with my kids, this is what I've done, so I'm able to do that. But my experience is that if you ask really honest human questions, the same sort of questions you'd ask of people that you love and care about why something's happening, then actually people respond. If you want to say anything else.
Yeah, I would agree with that. I think it's having that confidence to ask those questions, isn't they? And often we can dress that up in language that mean people can't understand, aren't able to engage in that conversation. So it's really stripping all that back and saying, tell me why you done this. What would the best day look like? Help me understand that. So you can really start to, get an insight of people, know what makes them tick, know the things that they're passionate about, so you can build on that and build that trusting relationship together.
I'll just say one more thing about so very specifically with Tyler. So you can imagine there's a group of us sat in a council building office with Tyler's mum and dad, and they were talking about they really are desperate. They don't want to send their 12-year-old son away, but equally they can't see what else to do, and they've been told very clearly that that's what needs to happen. And they talked about what would happen at this place, and we listened and we kind of probed about them, and what would that look like, and what sorts of things do you think will happen? And then I think the question that did it was, I said, and what about when he comes back, because he's 12 and he's going to go away until he's 18 or 19, and then what will happen? Will he? And I remember actually saying, do you think he'll be, or will he be different? Will he be cured? And that was the moment at which the mum in particular kind of, you could see her kind of deflating on us and go, well, actually, I don't know what I guess I haven't really thought about when he'd come back, because it was all about just the moment of now, because they're so desperate. It's the moment of now. And that's when we said, well, okay, if we could think of another way of doing it that would enable him to stay at home, would you be up for it? And yeah, of course, absolutely.
Brilliant. So a question that's come in that's linked to that. So the link to this question of like different conversations, connecting with people's needs, starting where they're at. Question that comes in that I think I know the answer to. I think I know what both of you are going to say. How does this transfer? So in both cases we're talking about examples where of kind of high cost, like individuals where the system has said we don't know what to do with them. How does this transfer to people who aren't in crisis?
Okay, so I think for us, certainly the work we've been going on, it's not about children just in care. It's about before that and that educare. And I think often what happens is families, young people, they come forward and say, I need help. actually what our systems are really good at is say, tell you what, just get a bit worse and then come back and we might help you then. So this is really about how do we start to be responsive and really have that conversation at that stage when things are coming up, so we can say, well, yeah, of course, early intervention prevention is so much better. Help people when they're asking to be helped, be readily available at the time when people need that support. So I think, again, that's something around your processes that are built up to almost, a threshold, don't quite meet the mark, how do we how do we move away from some of that, but also, as professionals, as humans, just have that conversation, be prepared to listen and see what we can do from there.
Yeah, completely agree. We have to work out, so part of I know there's questions about cost that you'll come on to, but part of the cost equations that we have to do with the project in West Sussex, and it's true of quite a lot of other projects around the country that are going on at the moment, is we have to work out, at the moment we spend a huge amount of money on stuff that doesn't work for people, and that is true of children's and adult services. So what we have to work out is actually, if we can spend money at the right time in the right place, then it will work. And we, there's questions there about austerity. Yes, we are in times of austerity, but there is still money in the system that we are spending wrongly. So I think that we have to work out how can we, at the moment, so go back to Tyler. Tyler was going to cost £180,000 a year. That money isn't going to get less. So is he going to come back at 18 or 19 and suddenly cost 2 and 6? No, he's not, because by that point, he's been in the system for a long time. He's going to come back and cost a lot of money as well. So actually, if we can, and he's currently, the budget's below 40 grand at the moment a year, below 40 grand, and that's with some one-off expenses in that. So actually, if we look at moving the money around differently and are brave enough to do what it's really hard to do in current financial times, which is to say, we know that if we put a couple of £100 in now, or a couple of £100 worth of support in now, very practical support, then we know that it's not going to get bigger. But you've got to be brave to do that at the moment.
Brilliant. Alex, anything on the kind of finance? There's quite a lot of cases, a lot of questions around what's the financial case for working in this way.
Yeah, I think the financial case, when you look into the cases, as Trisha's described, like Tyler and others, it's irrefutable, really. So I think that the financial case is there. We've got, across children's and adults, the cost of young people, adults being cared for elsewhere, that's not working, that contributes to the culture of being institutionalised, not being able to work together in the community, just adds to that ongoing expense. I think we believe that if we can care for children in Wigan, in the family home ideally, or within a home within our local community, that enables us to reinvest probably around about £5 million, what we're currently spending on commissioned activity. We can reinvest that in to our local services, local communities, and have better outcomes.
Brilliant. So the final question I'm going to ask, and I know there have been lots more that we can follow up with afterwards, but the final question is kind of linking us back into the title of the webinar. So what does it take to deliver truly person-centered care, and the program, the named social worker program, that this question is emerging out of, and that's why we're bringing it to you today. So we've heard from lots of different examples, from different sectors in some places and different places, about some great person-centered practice, different types of practice, what it takes at a system level, what it takes for individual workers, and I just want to ask Alex and Trisha, in terms of what you've talked about today, what you think are the biggest challenges for social workers in terms of taking on some of these ways of working, and kind of being able to do these things differently, like based on your experience.
Oh gosh, I think we have to. I think it's back to humanity. I think we have to, and it's a permission thing. I think that we've a lot of the practitioners that I have got to know recently it's almost like they haven't got permission to act professionally and make really good judgments about what they think's the right thing to do. That we've bound people up with processes and rules and regulations that people have forgotten of the humanity and the person within that. So that actually, if we say that we trust you as a social worker, actually what you came into social work for was to help people get gloriously ordinary lives. I believe that, and that's what you want to do, and you want people to be able to get the same things that you would want for people who you love. Then actually, if that's the approach that we allow people to take, then they will come up with the solutions that they would come up with if they were having a conversation with someone they did love. So it feels like we have the parallel universe of service land is that we come up with very strange solutions that we wouldn't want for ourselves or anybody who we love. So there's a permission thing there for me.
Absolutely, and just to reflect that's one of the biggest things that came out of the Named Social Worker pilot in the first phase. The permission to try something different was actually enough in a lot of ways for the social workers who took part to feel empowered to challenge other professionals, to try different things. So it's really powerful.
I think, and to have huge aspirations as well. I think people have lost their aspirations sometimes for people.
Anything to follow up on, Alex?
Oh, I completely agree. The permissions, the aspirations, really challenging ourselves as a workforce around, is that really good enough? Is it ambitious enough? And then I suppose around those professional behaviours are critical to that, to really challenge, want more, be curious, having that real commitment to do above and beyond.
Fantastic. Thank you so much, Alex and Trisha. And now I'm going to invite Lynn Romeo, Chief Social Worker for Adults, to come and sum up kind of what stood out for her as part of this webinar, and the lessons that we can take forward.
Great, thanks. Well, it's been a fascinating and engaging webinar, so thanks everybody who's contributed. Not surprisingly, I suppose the things that have really stood out for me are a kind of reframing and returning to great social work practice, and I suppose we're redefining it in the 21st century. But I think Alex summed it up actually when she was talking about we all need to think about a practice model that really starts with what matters to the person, to have aspiration in terms of what outcomes they want, and sometimes that does mean helping them explore that and being aspirational and having hope and optimism for what's possible, and then really working in a strengths-based way and very personalised way with those individuals and the family or social network around them. And I guess that means we truly and authentically really do get alongside and understand people, and that has to be a shared approach across the whole system. So everybody who's there to support and help and do what they can, whether it's schools, health, social workers, whoever, we have to share that approach, and we have to share a positive risk-taking approach to how we support people. So that shared practice model seems to be the thing that can make a real difference in the teams that have discussed it. But there was also something for me around the consistency and the intensity of the support, like really focusing on what difference are we going to make and how are we going to make it. And it's not just about carrying on being the continuing person in somebody's lives and that's about it. You've really got to think about how you make use of that professional relationship, because it's the relationship that seems to make the real difference, but it is what you do with that relationship that really matters. The other thing I think is around the actual skills development, and I think one of the things, particularly around sometimes working with people with learning disabilities, whether it is children or adults actually, the skill in how you communicate and engage, deepening those kind of creative ways of really getting and understanding what matters to somebody. I think we've neglected that a bit around the actual social work involvement, and we sometimes leave it to the therapists or the care workers or whoever. And I think if social workers are really going to understand and engage with, they've got to take some time to develop those skills. And the importance of, we just can't train people and that's it, let them get on with it. But it's got to be an ongoing, continuing deepening and curiosity around skills and knowledge, and critical reflective supervision or opportunities to discuss things together and really think and challenge ourselves around aspiration and what's possible has to be embedded within the agencies we work in and across the agencies, so that we really do sustain that practice culture change. And of course that can only happen if we've got the leadership, practice leadership at all levels and across boundaries. So the kind of points that were just made just before I started to speak around giving people permission and empowering decision making with professionals, so that they can really practice in the way that they think will make the biggest difference to people's lives. That's got to be owned by and created by people at the top, and then distributed amongst everybody. But the other thing I thought came across really well, which is something I really think we underplay a lot, is how you create that sense of hope, optimism and fun and happiness, and that part of that is having a genuine belief that we can really make a difference, and that the person really can, or the family can really have a better life, or things can be better. So that is really important, I think, and we wouldn't want there never to be any fun or laughter in the way we live our lives. So it's got to be a part of what we do. So I think that covers most of the points for me, and it's just fantastic to hear all the great work that's going on out there. So we just need to think about how we can support and develop it further. Thank you.
Brilliant. Thank you, Lynn. And thank you again to everyone who has contributed. We managed to keep to time, which is fantastic. And just to say that we'll be following up with the slides, and any specific questions we can respond to everyone who has signed up kind of on the Eventbrite. So in terms of kind of a follow-up from us, we'll add everyone who's participated to the Named Social Worker mailing list, and so we'll keep you updated for future communications. And hopefully it was a really valuable session for everyone who joined. I know I feel really excited and inspired by the kind of different examples, but of this work, but also some of the shared values that sit across it. So thank you very much, everyone, for taking part.